Good day, sir. I'm Kimberly Baswell from BSN 3B, and today what I'm going to perform is administering oxygen by nasal cannula. The goal: the patient exhibits oxygen saturation level within acceptable parameter. So, the oxygen administration is the process by which supplemented oxygen is administered in high concentration than that of atmospheric air. The purpose of oxygen administration is to relieve dyspnea, to prevent hypoxemia or the low level of oxygen in the blood, hypoxia, which is the low level of oxygen in the cells, and also to increase the oxygenation in tissues. For the equipment, we need to check for the oxygen delivery device as ordered by the healthcare provider. Next is oxygen tubing, so we need to consider the extension tubing. Humidifier if indicated, sterile water for humidifier, oxygen source, oxygen flow meter, and appropriate room signs. Now let's proceed to the implementation. Bring necessary equipment to the bedside stand or over bed table.
Go.
Perform hand hygiene and put on PPE if indicated. Close curtain around bed and close the door to the room if possible. Explain what you are going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. Then place no smoking signs to the appropriate areas. Then, identify the patient. Good day, ma'am. I'm Kimberly Baswell from NUST, and I will be your student nurse from 7 a.m. to 3 p.m. So, ngayon, ma'am, lalagyan ko po kayo ng nasal cannula. So, ito po ay ginagamit natin para po dumaloy ang oxygen sa inyong katawan. Ginagamit din po natin ito para po tumaas ang inyong airflow at maibsan po yung hirap niya sa paghinga.
Okay.
Pwede ko po malaman yung pangalan niyo po, ma'am?
Elisa Basyo.
And yung birthday niyo po?
April 14, 1968.
Okay po. Connect nasal cannula to oxygen setup with humidification if one is in use. Adjust flow rate as ordered. Then check if oxygen is flowing out of bronchs. Place prongs in patient nostrils, then place tubing over and behind each ear with adjuster comfortably under the chin. Ilalagay ko na po.
Sige.
Alternately, the tubing may be placed around the patient's head, with the adjuster at the back or base of the head. Then, place gauze pads at ear beneath the tubing as necessary. Adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. Hindi po ba mahigpit, Nay?
Hindi, okay lang.
Okay po. Encourage patient to breathe through the nose with the mouth closed. So, Nanay, hinga po tayo sa ilong habang nakasara po yung bibig natin. Reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscle, or dyspnea. Tapos i-assess ko na rin po yung respiratory status niyo. Then, remove PPE if used, perform hand hygiene, then document. Put on clean gloves, remove and clean the cannula, and assess NIRS at least every 8 hours or according to agency recommendations. Then lastly, check NIRS for evidence of irritation or bleeding. Check ko lang po yung ilong nyo.